Good night, everyone. Welcome back to one of our webinars. First, I would like to thank brightbud.com for sponsoring them. Of course, you for being here. I would like to remind you that throughout the presentations, your microphones will be muted. We will give some time at the end of the presentation to for you to ask questions, and we will answer them, of course. We would like to remind you that these webinars come from Dr. Martinez and my medical experience, but they do not replace a medical consultation. If you're not watching this webinar live, or maybe you have more questions at the end, you can go into brightbud.com and record a video question, and me, Dr. Martinez, or someone else who is expert in this can answer your question. So let's begin. Okay, so tonight we're going to be talking about a very interesting topic, which is vaginitis and vaginosis. With me, helping me with this presentation is Dr. Luz Martinez, as well as me. For those of you who don't know me, my name is Jaime Mesa. We're both medical doctors who work with chronic conditions like this one that we're going to talk about. Well, this is not necessarily chronic, but like this condition. First of all, I would always like to start with some amazing facts. In this case, we have to know that the vagina is a cavity that is full of non-harming and even beneficial microorganisms, which include several different types of bacteria that actually protect the vagina from infections. Also, it's very amazing that vaginas are very different one from the other, depending on age, race, and basically certain genetical factors. They might differ in length and even the kind of microorganisms that live inside of them. And the most amazing fact I would say is that vaginas can stretch more than 10 times its normal diameter at the moment of birth, which is pretty amazing because they go back to normal. And not many people have witnessed a birth, but of course, as doctors, we do kind of frequently. And it is definitely amazing how can a baby go through. And wow, that's definitely one of the most beautiful things. So very amazing. So let's talk about some numbers about vaginitis and vaginosis. Around 75% of women will ever experience an episode of vaginitis, so that means 3 out of 4. The most common cause is bacterial vaginosis in more than 50% of cases, followed by Candida infection, which is fungus. And the third most common cause would be Trichomonas, which is a type of parasite similar to bacteria. Then what is vaginal candidiasis, which is basically one of the types of infections women can get. It's also known as yeast infection, which is basically an overgrowth of a type of fungus, which is from a family of fungus that is called Candida, that basically normally colonize the vagina. This happens when the pH of the vagina changes, and when the microbiota changes also, making it easier for this fungus to overgrow. What are the symptoms of yeast infection? Well, number one would be vaginal discharge. Here I have to add that there are many conditions that might cause vaginal discharge, and this discharge itself might be very different depending on the cause. In this specific case, when it's a yeast infection, this discharge is commonly whitish with some like chunks in it, similar to like cottage cheese. This is how they normally describe it. I know it's kind of weird, but that's how it's described in books, and it's actually like that. It's somehow odorless or like a metallic smell, but not necessarily foul smell or bad smell. Another symptom might be itchiness and burning sensation, because since the pH is changing and this fungus overgrows, grows out of control, basically, that makes the pH a little harmful to the skin, especially, of course, in certain parts of the vulva, which are very sensitive. So you might get a burning sensation, and even in some cases, burning with urination. So we might mistake this with urinary tract infection. And it's important for everybody to know that this vaginitis and vaginosis are not urinary tract infections. They are different. One thing is to have the urinary tract, which is the kidneys, ureters, bladder, urethra, infected, and another thing is having the vaginal tract with some kind of infection. Might have similar symptoms, but they're not the same. What are the risk factors? Well, diabetes is one risk factor. Diabetics have their immune system do not react as normal, so they are more prone to these infections. Also, there's of course the amount of sugar that's on blood and on the fluids. It's also very attractive for saying it somehow to fungus, in this case candida. So that's a big risk factor. People that are taking steroids or any kind of treatment that might lower the immune system are at a higher risk factor. People taking antibiotics, especially if they're used for a long term, because of course the purpose of antibiotics is killing bacteria. And as I mentioned, the microbiota, it's made of different types of bacteria that they're not harmful, but of course antibiotics cannot choose which type of bacteria they're gonna kill. So sometimes they might reduce the population of some good bacteria, and then yeast, candida overgrows. Using tampons or any other object that might occlude the normal flow of any secretion that is produced in the vagina. It's especially if it's there, if you put it and you leave it there for a long time, it's a risk factor. And the number of basically the amount of sex that you're having. Of course, the more you have, the more risk you have it for many reasons. But of course, we have to remember that basically the penis is a foreign object that has its own pH and its own kind of bacteria. And obviously semen is a secretion that also has different pH. So the more sex, the more chances you have to change the microbiota, and then it's easier for you to have a yeast infection. How is it diagnosed and how is it treated? Basically, we do it very clinically. So it's basically the same story. Doctor having whitish discharge. It's not really, it doesn't smell bad really, but I have some itch or some burning, just to confirm it, because most cases we just treat them with that, but of course we do a pelvic exam if we can, and it's recommended to take a sample and just do a smear so we can watch this under the microscope, and then we confirm it when we see the yeast, basically in the slide that we're watching under the microscope, which you can see there in the upper right corner. How do we treat it? The treatment, fortunately, it's very easy, and as I mentioned before, this is very common. I mentioned 3 out of 4 women will have it, and usually this is something that happens more than once. because there's so many factors that are related to it that it sometimes is difficult to control it. Not necessarily hygiene, it's always the case. Actually, it's almost never the case. We use diflucan, which is fluconazole, which is an antifungal, similar to like antibiotics that work on bacteria. This works on fungus. You can also have antifungal medication in creams or gels, which we also use. We prefer oral antifungals because it's easier and it takes usually one pill. In the other hand, creams, you have to use them for some 3 days, some others you have to use it for 7 days. So it's easier for the patient not to follow the whole treatment. So we prefer oral, but topical can also be used. Of course, we also recommend probiotics, not only for this, but you will also see that for bacterial vaginosis, which replenish the vagina of those good bacteria. You can get it in yogurt or just buy them in like pills or capsules. You can buy them, they're over the counter. And the last thing, the recommendation is you have to actually take care of some soaps or products that you might be using to for your personal hygiene, especially in the vulvar and vaginal area. We do not recommend anything that has color or perfume to use there, because that changes the pH. Basically, we would recommend a white, odorless soap to use in that area. And even when it sounds surprising, not even the products that they're commercially advertised as feminine soaps or anything like that, we do not recommend them. So just regular odorless and colorless soap is just all right for that part. You can use the normal soap for the rest of your body. Because actually trying to help women say, oh, but I wash, I'm very careful with my hygiene, but maybe the problem is that you're not using the right soap. So that's one of the.
Okay, now let's talk about another different type of vaginal infection. In this case, is the bacterial vaginosis. And this is the most common cause of vaginal discharge in women, as Dr. Mesa mentioned before. It is nowadays treated as a sexually transmitted disease, at least in the first episode of this kind of disease, because we have people who have recurrent symptoms or recurrent bacterial vaginosis that are not really sexually related, but at least the first symptom, yes, it is sexually related. It is 2.4 times more common in African and Hispanic descent women. Why? There is not a certain cause now, but as Dr. Mesa mentioned, we have normal microbiota, and it has a different amount between different ethnicities, and it seems that African and Hispanic women have a little bit less amount of this kind of normal bacteria in their vaginas. And in Europe and in North America, the incidence is very high, until 30% in all the population. And in pregnant women, it will increase a little bit more, even 22% more than this 30%. Now, why is it caused? It's quite similar, as Dr. Mesa was telling you. We normally have normal microbiota that is made of good bacteria. In this case, lactobacillus, as you see, the picture is the most common normal bacteria we have in the vagina, and it helps us preventing the overgrowth of other kind of harmful or bad bacteria with the normal pH and normal vaginal environment. When it is changed, for example, in sexual intercourse or with some kind of soaps and antibiotic, as Dr. Mesa mentioned, there is an overload of other kind of bacteria. In this case, Gardnerella vaginalis, as you can see in the picture, is one of the most common one we see in this case, in this type of bacterial vaginosis. What are the risk factors? As I was mentioned. The ethnicity is an important one. Hispanic and African American women. We have also seen an increased risk if you have an intrauterine device because of the material sometimes and the device itself, and it helps the overgrowth of the bacteria. It can almost reach the endometrium that is quite serious, more serious than the vaginosis. Of course, the sexual intercourse and most important, multiple sex partners is one of the most important risk factors for this kind of diseases. And as you have seen in pregnancy, it is a quite common disease we also treat. You can have it more than one time, just 3 or 4. Um, Study says that it is caused by vitamin D deficiency. It is not 100% truth, but this is the statistics. And it is so important to treat every um, episode of bacterial vaginosis when you are pregnant, because it can lead you to preterm birth or even infections in pulmonary or meningeal infections in your newborn for this kind of bacterial vaginosis. Now, what are the symptoms? It is important to know that only around 50% of women with bacterial vaginosis have symptoms. And the first and the most important one is a vaginal discharge, as in the present previous disease. But in this case, the discharge is white or maybe yellow. It has it is a thin one without molecules, and it has an important characteristic. It is a fishy smelling vaginal discharge. So it is important to differentiated from the other kind of vaginal discharge. Also, vaginal itching is one of the most important symptoms, and pain after sex or pain during urination, as Dr. Mesa mentioned, also in Candida, can be present. And how is it treated and diagnosed? The same, we need a good physical exam with a pelvic examination. Here we can see the characteristics of the vaginal discharge, the color, the smell. We can take some samples and look it at the microscope, or even take the pH number to see, or that is related normally with bacterial vaginosis. In the treatment, we have two main kind of drugs that we used to use in these diseases. The first and the main one will be the metronidazole. We can use this also in oral presentation or in vaginal presentation, and clindamycin also in oral and vaginal presentation. We usually ask the patient for the preference, oral or vaginal. Most of patients prefer vaginal presentations here, because the treatment will last just 5 days. With oral treatment, it will be like 7 days almost. Also, with oral treatments, you will have some kind of um, gastrointestinal disturbs, so most of women will prefer vaginal presentations. Also, as Dr. Mesa mentioned, probiotics will be an important will yes, we have an important role in these kind of infections. And why is too important to treat as many of vaginal bacterial infections? Why? Because these kind of chronic infections can lead you to another type of diseases in another sites of your vaginal tract. For example, the endometrium and the fallopian tube. Those are called the endometritis or salpingitis. They can lead you to surgery at the end stages. Also, bacterial vaginosis is a risk factor for having another kind of sexual transmitted diseases, for example, gonorrhea, for example, chlamydia, or even HIV. So it is important to treat all your symptoms or your episodes of bacterial vaginosis.
Okay, now here are 5 of the most common questions that we receive in our practice. Most of them were already answered in the presentation, but it's a good way to make a summary. So first, are vaginitis or vaginosis sexually transmitted diseases? The answer, we already mentioned them. It could be yes and no. It depends. As Dr. Martinez mentioned, bacterial vaginosis in its first episode might be considered sexually transmitted. There is one specific type of or subtype of bacterial vaginosis in a certain way that we didn't mention, and that is called trichomoniasis. Trichomona, it's a parasite that can cause inflammation and infection of the vagina. In this case, this specific case, it is also a sexually transmitted disease. And why is it so important to consider this an STD or not? Because if it's a sexually transmitted disease, that means the partner should be treated also. So we try to identify who gave it to whom so we can treat it. If it's a normal partner, then they should both get treated. And if not, then obviously the use of condoms would be definitely advised for this kind of infection. Can men have yeast infections or some other organisms that cause any of this? Or can I pass it to my partner? It's a very common question. Well, yeasts, or in this case, a specific one, which is Candida, it's normal. It's a normal fungus in different places of not only the body, but different surfaces. It prefers warm and moist places. So of course the vagina is the ideal. We say that it can be present in men's penis, but it doesn't necessarily mean that it passes as a sexual infection or that you can cause a problem. Usually men can have it and it might not necessarily cause any symptom at all because it's not the ideal place, especially for circumcised patients. In the other hand, as I mentioned before, trichomona, which is another type of infection, this, as I mentioned, is an STD and it can be passed to the partner. Sometimes it can have some symptoms like burning with urination or maybe not symptoms at all for men, but definitely we can pass it to women. Is it okay to have intercourse while in treatment for vaginitis or vaginosis? I'm definitely, I mean, I wouldn't recommend to have it because of course it is a tissue that is supposed to be healing, and sexual intercourse is some kind of trauma to that tissue, and it might not lead to a appropriate healing. Also, in certain cases, the partner might be contributing to some factors that are causing the infection. So of course, it's like trying to heal something and then get it back again. So usually we recommend no sexual intercourse for the duration of the treatment, and even a week or 10 days after you finish it. Is it normal to have clear discharge every month? Because we said in both bacterial vaginosis and yeast infection that one of the most common symptoms is discharge. But then is it possible for you to have discharge without having this? I don't know what Dr. Martinez thinks. Do you think it's normal for women to have a discharge without necessarily having to have one of this?
Yes, in fact, each month when the period arrives, there is a change in estrogens levels, and this appears to produce some kind of normal vaginal discharge that normally has no color, will be transparent, even a little bit white, without any smell. And yes, it will be normal each month to have it.
Okay, so yeah, definitely normal. And what is the worst that could happen if you don't get treated? Dr. Martinez mentioned at the end of the presentation that it's an increased risk for endometritis, which is the infection of the lining of the uterus, and PID, which is pelvic inflammatory disease, which is when that infection goes to the fallopian tubes and even sometimes the ovaries, which is a very, very, very bad infection, difficult to treat, very, very painful, and can lead itself a risk factor for other conditions, including infertility. So definitely it is important. It is very, very common and very easily treatable. So now you know it. If you have any of the symptoms, it is good for you to go to your doctor and prevent it by having good hygiene, trying not to use the kind of soaps that I was mentioning, like use odorless and colorless soap, and you will do good. So thank you. And now it's time for your questions.
Sir, I have a question.
Yes.
I think Dr. Martinez had said, and if I hope I'm quoting her right, she said bacterial vaginosis is a risk factor in STDs, and she mentioned AIDS. I'm HIV, I'm sorry. Was that correct? And can you expand on that if that's true?
Yes, I mentioned that. Yes, in fact, is one of the most common cause of another type of transmitted sexual diseases. Yes, AIDS or HIV is the same thing, and yes, of course, it will be one of the risk factors of having that, because with a bacterial vaginosis, it means that you have another type of risk factors. For example, having multiple sexual partners, that is one of the most risk factors of having AIDS. So that's the relationship between those both.
Okay.
And there's another reason for that. Of course, yeah, the risky behaviors that you have might lead you to another STD, but also there's some bacteria, for example, that causes gonorrhea or chlamydia, which need in a certain way a part of the mucosa that is not intact. If there's nothing there, it is harder for that bacteria to actually enter and cause an infection. But whenever you have bacterial vaginosis, for example, and that skin is already broken, bleeding, or swollen, inflamed, then it's easier for other bacteria to just go through and cause an infection. So those are the two main reasons.
Okay, got it. Thank you.
Okay.
You're welcome.
Doctors, is douching good or bad when it comes to the vaginitis?
Okay, well, that's very, very, very good question. The answer is plain and simple. It's bad. I don't think now there's any doctor that would really recommend douche because definitely what it does, it's definitely changing the whole pH and the whole microbiota just by washing it. It's basically like putting water or saline. So it might, in theory, seem right. Okay, let's wash everything down and let's clean it. But in the long term, you're also cleaning the good bacteria and changing the whole environment, and it will end up being worse than better. So definitely a big no. Very good question.
Thank you.
Yes.
You're welcome.
Mesa,
Yes.
some men get yeast infection because of the medication they take, particularly diabetics. That's a side effect, a possible side effect of the medication.
Well, yeast infection, of course, this type of fungus, candida, might infect different places of the body, not necessarily. I mean, we're talking about a vaginitis, but it might also go to somewhere. Like I said, it prefers moist and warm places. So the mouth might be one place, the throat, the esophagus, even some of the folds of the skin, like under the breasts or under the arms or in between the fingers or the legs. So in the case of men, it's more common to have it in one of those places. In the case of diabetics, it is an increased risk factor for any kind of, for infection of that fungus in any part of the body. Now, when we talk about medications, it's not necessarily the medications for diabetes, but for other conditions that might make you with a higher risk. For example, for arthritis, immunomodulators like methotrexate or steroids might lower your immune system, and this fungus that is normally found in your skin and in your body without causing an infection now causes an infection. And if this patient is taking this medication and on top of that it's diabetic, then that would even increase more. So I wouldn't say necessarily the diabetes medication, or at least not the normal medication, not the most typical, but diabetes itself is a risk factor for yeast infection in men and in women.
Thank you.
You're welcome.
So I know the pH of the stomach is obviously not directly related with the pH of the vagina, but is there like the things that you eat or drink, could they have any effect on the pH down there as well?
Yes, absolutely, yes. We have some medications. For example, when you have gastritis, you usually have your pH a little bit more elevated than normal, and we have some kind of medications and some kind of foods we recommend to avoid or to consume to lower down the pH or make it up. Yes. In gastrointestinal tract, yes, it depends on the food and on some kind of medications.
And to answer your question about the relation between the stomach's pH and the vaginal pH, it's also a yes. There might be related in several ways. For example, number one is if we consume probiotics, we drink them, they will grow and help the vagina. Also, they can go from one place to another, translocate, which we call that. Also, we have to remember that for the stomach to be acid, that means the whole acid of the body, it's concentrated there in certain periods, like for example, after a meal. So I don't know if this has happened to you, but after you eat, then you get sleepy, you want to just sleep. It's because alkali in the blood, when the blood is alkaline, basically that causes your neurons to actually shut down a little bit, so it causes sleep. So why this happens after you eat? Because you eat and the stomach needs to dissolve whatever you ate. So the whole acid concentrates on that part. So the blood sends all the acid to the stomach and makes the rest of the body alkaline, including the vagina. So if you're eating something or your stomach is very acid all the time, that might actually change the pH of the rest of the parts of your body and might make you in a higher risk of yeast or bacterial vaginosis. It's like, it's the fire. If you have all the logs concentrated in one place, the rest of your house is probably gonna be cold. I don't know if that was a good analogy.
Yeah,
that's
yeah, that's fine.
Okay.
Yeah, I have a question. Is it just as likely for a woman to become pregnant if she has a yeast infection as it would be if she did not have a yeast infection?
Well, pregnancy or becoming pregnant is a very, 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 I will not say complicated, but very special process. It requires, it's like a recipe. It requires a lot of specific things to happen for it actually take place. So we never think about it, but it's not as easy as we think. One of the things that we have to know is that the normal pH of the vagina, it's not necessarily very welcoming for the sperm. So the semen itself counteracts the acidity of the vagina being alkaline. But if there is something else that is causing it to be more acid, or the other way around, but usually is more acid, then this will definitely kill sperm easier. So definitely will make a pregnancy more difficult.
Thanks.
You're welcome.
Mesa, does vaginitis or vaginosis cause endometriosis?
It might, not necessarily. The most common cause for both endometritis and PID, which is pelvic inflammatory disease, are some microorganisms that are considered themselves STD, like chlamydia and or gonorrhea, but are not the only ones. The microorganisms that cause bacterial vaginosis might cause endometritis. Endometritis is more common after birth because, of course, the endometrium is more exposed to the whole outside world after birth. So it's very, very common, but that doesn't mean it's exclusively from that patients get it. You can also get it at a different moment in your life because you didn't treat bacterial vaginosis. They might actually go up through the cervix and invade the endometrium. It's not very easy to happen, but it might eventually end up like that if you have it for a long time untreated, or if you have it more than once, is definitely a risk factor for endometritis. It can happen, and actually it's a chronic endometritis. Doesn't necessarily produce a lot of symptoms, but it will produce pain and brownish discharge that you're not sure where it's coming from. Then it goes away and it comes back, and then we start suspecting that it's an infection. So the answer is yes, it can be caused by a bacterial vaginosis.
Doctors,
Yes.
for a pregnant woman suffering from either of those, would you recommend a vaginal delivery or a C-section?
Okay. Usually it depends. Usually vaginal delivery is still indicated. It's not, having bacterial vaginosis or vaginitis is not enough for us to recommend C-sections. It also depends on what microorganism is there. But usually the answer will be it's okay. The thing is that we will treat it. Especially we have to know that the colonization by certain bacteria might be normal for the women, but not very, but it could be harmful for the baby. For example, now it's routine to make a culture of the rectovaginal area of pregnant women in the 36th or 37th week of pregnancy, just after birth, so we know in the delivery, in the birth itself, if we need to put antibiotics. That would be just the only consideration that we might have. Vaginal vaginal delivery is still recommended. The only thing is that we would use antibiotics just to prevent further infection and disinfection to go to the baby.
There are some recommendations or some guidelines we have that at the final stages in the pregnancy, for example, in 34 to 37 weeks of gestation, we need to treat every vaginal infection, but we can have the vaginal delivery. But if we have the vaginal infection at the 37 or 38 week, we should start antibiotics to the newborn, as Dr. Mesa mentioned, because they are in an increased risk of having pulmonary or even meningitis in the first days of birth.
Okay. Thank you.
Okay.
Okay.
Maybe one last question, if you don't mind.
Yeah, of course.
Thanks. Can you treat a yeast infection? Can a woman treat a yeast infection while she's having her period?
Yes, yes, she can do it because period doesn't have any in common with the infection. Even in fact, if you have the period, it will help you because it changes a little bit the pH of the vagina. But you will need to treat it also with the antifungal agents that Dr. Mason mentioned.
The only consideration I would have with regarding the menstruation would be that it's the type of medication that we will use. As we mentioned, for both bacterial vaginosis and vaginitis, we might use topical treatments, creams, gels. In this case, if you're having your period, it will be a little bit more difficult for this to actually stay in place. So if that's the case, I would recommend oral treatment in this case. It's not that it cannot be used, but it would be more recommended. That's the only thing, but it can be treated while you have your period. Yes, definitely.
Thank you.
You're welcome. Okay. Well, thank you. Thank you all for being here. I hope you liked our presentation. Remember, if you have further questions or you're not watching this live, you can go into brightbud.com and record a video question. Thank you, Dr. Martinez, for your help, and see you next week. Have a good night.
Thank you. Good night. Good night.
Thank you, everyone.